I'm Dr. Ian, and today I want to share with you what is a good test to take when you're having GI type issues to figure out what's going on with your terrain. Now, obviously, you can go to a GI doctor if there's something significant that you want to go to a specialist and have them run a colonoscopy to see what's going on with the tube, so to speak, and the GI lining. If there's something obvious like polyps or ulcerations or outpouching, then the doctor may need to perform some invasive procedures in order to fix the problem. But if you go in for a colonoscopy and the testing comes back negative, despite having bloating issues or constipation or acid reflux or diarrhea, but there's nothing going on a colonoscopy, then what can you do from there? Well, my best recommendation is to do what's called a GI map test, which is a specialized stool test. Now, this is not an ordinary stool test that you do at a typical lab that your doctor sends you to, because typically when you're getting a stool sample that your doctor sends you out for, it's typically one particular isolated bacteria or virus, such as H. pylori or C. diff. And that's about all you're going to get from that sample. You want to see what's going on in the terrain overall. You want to see your beneficial bacteria, to see what levels they are and to make sure they're diverse and at the right levels and in balance. When it comes to opportunistic bacteria, you want to make sure that they are in line and at a certain ratio. Also, you want to rule out parasites, worms, and other types of infections that normally don't reside in the GI tract. You can also see whether or not you have any damage to the GI lining. You can see if you have certain proteins that are elevated in the system, because if they are, that can show that there's signs of erosion to the gut lining. And so these are at microscopic levels typically, and it tells you a lot of information. And if you have any of these things, you can treat things conservatively more than likely, particularly after a negative colonoscopy and other testing that a GI specialist might go through, and all the tests come back negative. This is a great alternative to look at. So what I'm going to do is I'm going to show you an example of a GI map test. And this is what it looks like. So the first page is ruling out different pathogenic bacteria that normally doesn't reside in the GI tract. So this is a sample report, and it's showing pathogenic bacteria here. So for example, this shows a C. diff example. Right in through here. So if it's elevated, it'll show, this alarm system will go off and show that there's the presence of C. diff, toxin A, toxin B. And then if we scroll down, these are parasitic components, and then viral. On the next page, it'll rule out H. pylori. You have a lot of different types of H. pyloris, and so it'll show whether it's positive or negative. And then here is the area where it shows the normal flora. So these are healthy bacteria that helps to protect the system. And so as you can see, it shows low with the Escherichia and Lactobacillus species. And then here the Akkermansia shows high. So you just want to make sure you're within these reference ranges and make sure that things are in balance, because if they're not, then you're not going to have that appropriate protection. And then what ends up happening is, you can see from the next page, these are opportunistic bacteria, and they should be below certain numbers. And so as long as your beneficial bacteria is in proper ratio, it's going to keep the opportunistic bacteria in bay. But as you can see here, the top section here, which says additional dysbiotic overgrowth bacteria, out of line, then it's going to create a disturbance or a dysbiosis in the gut. These are more, these species right here are worse, and it can potentially trigger autoimmune type of dysfunction. Here you have yeast and fungus. Down here, viral component. Here it'll rule out common protozoa of which are different, which is a different species of parasites, and then you have worms here. And then down here, I like this part because it just shows overall intestinal health. So here, whether or not your body is producing enough digestive enzymes to break down your macronutrients. Here shows certain proteins, immune system markers. So like for instance here, the beta glucuronidase, because this is high, this is a particular protein that knocks off a detoxification marker from the liver. And so then what ends up happening is you have a particular toxin that will recirculate into the system. And so if this level is high, then you can have the chance of not detoxifying appropriately. Here in the immune response, secretory IgAs, your first line of immune cells. So whether it's high or low, we can see what the status of your immune system is. Anti-gliadin, of course, deals with gluten protein. So if it's elevated, then it shows that you're making antibodies against gluten, which will therefore cause a lot of inflammation. If you have calprotectin, this is an inflammatory marker. If it's high, then it's a suggestion that you may have inflammatory bowel disease, where you have a lot of erosion that's taken place in the GI lining. And then here you have zonulin. Zonulin is a protein marker, where if it exceeds the 107 mark here, which in this sample case at 187 it is suggesting that you may have a condition called leaky gut, where you have all these proteins eroding and suggesting that you may have a hyperpermeability issue. So I really, this is my preferred test when a patient comes in and they're having GI type complaints. It's really helpful to the practitioner to see what's going on with the microbiome. Is it the normal flora that may be imbalanced? Do you have opportunistic infections coming in? Is it from parasites? Is it from H. pylori? Is it from C. diff? And then if so, what kind of damage is incurring to the GI lining? And so depending on what the answers are that we see from this pretty comprehensive stool test, it'll help us to facilitate the individual patient's treatment protocol, and we'll understand what we need to bring in as far as with herbs, botanicals, vitamins, and minerals. And in some cases, in rare cases, they need to be sent out for antibiotic or antifungal type of treatment, depending on how severe it is. But it really shows the markers that will really help to identify what the underlying cause is. And that's what functional medicine is all about, is finding the root cause of the problem. And once we see that, we can attack the issues at hand. If you like this video, go ahead and click on the like and follow me on this channel, and make comments of other videos you would like to see. We'll catch you in the next video.